Okay, go ahead.
All right, so I am Dr. Amy Bronson. I am a physician assistant. I am the program director at the Colorado Mesa University Physician Assistant Program. So I actually have been a practicing PA for over 14 years. Most of my clinical practice has been here in Western Colorado, practicing in otolaryngology and facial plastic surgery. I have been in full-time PA education for over 6 years. I helped start a PA program in Minnesota, got my doctorate in educational leadership, and then actually came back to Grand Junction at the time that CMU was exploring what would it look like to have a PA program. And so I feel like I have come into a place that is sort of my perfect sweet spot. I am in a community that I'm really passionate about, especially increasing access to care and also getting to do what I love, which is education. So I'm still practicing clinically 1 day a week. I still like to wear that hat, still think it's important to be with patients. But yeah, full-time in education now.
That's great. That's great. Well, tell me what has, with this corona outbreak, what has occurred? What's changed in your daily life?
Yeah, everything, right? Everything, I think shifting clinically, like shifting away from all of our elective procedures, but still trying to keep a little bit of access to care for our patients. And so I kind of run the dermatology side of what we do in our practice. I'm really seeing a lot of our skin cancers and doing a lot of the prevention for patients here in Western Colorado. And so that has shifted everything to, we're just trying to do some telehealth that we can, but really just trying to move a lot of our elective procedures out until May or June, and we can be back in with our patients. So that has totally disrupted what clinical life looks like for us. But all of us have been volunteering in different capacities within the hospital and within the leadership team to help with some of the COVID planning, just PPE devices and planning. So kind of stepped into a lot of different roles. I feel like we all now kind of wear different hats than we ever have before. And then everything on the school side of education has all completely shifted. So meeting with students, we've moved that all online. We're in our 3.5 full week of being fully online, which just seems crazy. And we're just learning and sort of leaning into that as we go. Having students drive by and pick up clinical items that they can practice at home. So they're still learning how to do their scrub techniques and how to get ready and what does that look like in preparing to go into the OR. So I'm trying to think outside the box and how we're doing that. We're really leveraging and leaning into technology to be able to do that. So the learning curve has been steep. Faculty actually spent their spring break, instead of being on spring break, we kind of moved all of our curriculum over spring break online. And so they really have been doing a lot of the heavy lifting, ensuring that we're still connecting with students and still making sure that their education moves forward so that they're prepared and ready to go out and deal with this potentially, and to be more prepared for what that could look like, and having more providers that are ready to take that on.
Mm-hmm. Definitely. Has it changed your clinicals? Are you able to have clinicals for your students?
Yeah, really good question. So thankfully where we are, we're a provisionally accredited program, meaning we're only in our 2nd year. So we just admitted our 2nd cohort that started in January. So our first cohort actually doesn't start clinicals until May. So we didn't have students actually on clinicals yet, but we are moving back their clinical start date. So it is shifting what that's going to look like. We're looking at a soft start potentially of having to do some iHumans online, and what does that look like for them to continue to do their training before they can get back into the clinics and hospital systems. And so thankfully we haven't had to sort of deal with that yet, but we're staring that down as we're kind of reconfiguring what their clinical year is going to look like.
Okay, yeah, that's definitely a big challenge. It's interesting to see how different schools are balancing that component. Yeah. Great. Well, on 2 different levels, how are the other employees? You said everyone's kind of volunteering, so kind of in the practice area, but then also how are your students dealing? Are they volunteering? So
it's a good question. So community service is a big part of our program. We really feel like being a part of this community, if we're going to be here, they're giving a lot back, and having our students out on their clinicals, coming in and teaching in the program. And so students have continued with our community service. Right now, we're actually partnering with a pediatric office here in town, and we're creating family COVID at-home survival kits. And so creating sort of tips and tricks for parents, and how do you kind of deal with the emotion of having kids in your home all day long, and then giving them a few tangible things of hoping to get kids off the screen, so sidewalk chalk, and we've gotten some donations for jump ropes, and we made actually these bingo cards that kids can go outside and write messages with their chalk, and trying to create some encouragement around that. And so students have been a big part of helping us create and brainstorm around how can we keep healthy families and our community safe during this time. And then we're actually sending those out in our backpack program. So kind of being creative with what volunteerism still looks like and how we're staying connected to our community. But they've been helping out at the health department and helping just with the phone line. So being able to help direct people and what they need to do, and do they need to be screened. And so trying to keep students involved in those pieces has been really important.
That's great. That's really unique idea about how to get it going. I know in my own house, we have a little too much screen time going on.
Right.
So
I mean, it's hard too. I've had that same moment of, 6+ hours of instruction that's all happening on the screen.
Right.
And then they want an outlet, and they want their screen time for having their screen time.
Exactly.
Yeah.
It is a challenge. And now I'm not sure if you guys got the snow out there, but we got about almost a foot of snow out here just in the last 2 days.
Really?
Uh-huh.
Oh, that is wild. No, we are
Yes.
free. We got some rain, but
Okay. No, we're covered, blanketed in snow again. So then that, at least when the weather was nice, we could get people out. But
yes.
well, interesting. And do you have what are your thoughts? This is where I get really curious. What do you think is going to change in education? I was in nursing education for 15 years.
Oh, no,
and I don't think I could have ever really predicted this or how to teach the students. So I'm curious what your thoughts are on that.
Yeah. Yeah, as I've continued to say, the team, right? Disruption brings innovation, and how we respond and adapt to this, I think it likely will change a little bit how we move forward. I think there's been a really big resistance on, you can't teach everything online. And while I do still feel pretty strongly that I think some of those tenets are true, communication styles and feedback. And but I think we're really learning that not only is this going to change education, I think it's going to change clinically what we do with medicine. We have really realized access to care can happen, and communication and connection can happen through telehealth. And so how do we prepare students now for the changes that they may face when they get out into the clinical world? And I do think that leveraging technology, we really have realized there is a lot more to technology than we realize. So, just in the way that we're doing testing and OSCEs, which are objective structured clinical exams, which we've theoretically always done them in the classroom, we're having students practice doing these history and physical exams, and then sending us their videos, and we're critiquing the videos and sending things back. And it is amazing how you can stay connected in really meaningful ways by utilizing technology. So I think we're going to see some shifts in, flipping the classroom a little bit more, doing a lot more of instruction that we record lectures and do that online. And then when we are face-to-face and interacting, we're doing a lot more of the hands-on learning together. So I think it has pushed us to do a lot of this on the front end, but I do think as we move forward, we'll be utilizing some of the pre-recorded things we probably have done before, and we'll be more prepared now and moving forward too. If something happens and the guest lecturer can't come in, we probably have a lecture that we've recorded or we have from this time that actually is going to be a tremendous resource.
That's great. Yeah, that's very true. What do you think in practice? What do you think is going to change in practice?
Yeah, I think we're realizing, and I think a big piece of it is going to be rebuilding trust with patients. We already see that, and our clinic is located in a hospital. And so we have a lot of resistance, even for patients wondering, is it still safe? Should I come for this appointment? It's not something I really need to do. So from a prevention side, can't you just see me, online? And yes, some things we can, but when I need to do a punch biopsy, I actually need you to come into the office. So I think it's going to take a little bit of time to rebuild sort of that trust factor that it is safe, that I do feel like I can come back. But I think it is going to help us in having those conversations with patients about, the preventative pieces that we do, and is there a way that we can connect and make it better access for them on some more of those on a more regular basis instead of having them drive, especially for some of our patient populations that drive 2.5 hours to come for an appointment. Yes, some of them want to come to Grand Junction to shop, but for some of them, they shouldn't be getting in the car and maybe driving 2.5 hours to come in for their appointment. So I think it is going to shift our paradigm a little bit and how we think about access, especially for our rural and frontier population.
Right, right. That was kind of my other question. What have you seen with the rural population? Do you have an impression of how they're dealing with this?
Yeah, I think that's a really great question. You know, it's funny, I always talk about Grand Junction is not really a farm town, it's truly a ranching town, and people really are pretty individual rugged, right? Like I live out on the ranch, I come in once a month and get all my supplies. And so I think for a lot of our patients that I've connected with, they're just still doing their thing. This is kind of the life they've lived. This is their connection point. I think for people that live here in Grand Junction, it's felt a little bit different in that, you know, people go out and they feel like, oh, it's a little eerie that there's no one around. And but as we've continued to talk, and as I've talked to a few of our patients, they really come down to this sort of essentialism piece of, hey, I used to have sort of these crazy things that I was always doing, but I'm kind of enjoying a little bit of being at home. And I think in the first week, it was kind of the settling into anew. The second week was like, yeah, this is nice. I kind of am enjoying this. And I would say a few patients I connected with this week that were like, yep, and I'm done. 3 weeks, that's kind of my limit. And I'm ready to go shop again. Or I'm ready to, have access to a few of the amenities that we had before.
Right, right. Have you seen issues with some of these rural patients that you can't connect with them because of broadband and internet access?
Yeah, so I would say that's the biggest piece, and just the learning curve for technology. You know, I really realized that if we are, you know, to prepare for anything like this before, really what we need to be facilitating in our office is how to telehealth from their end, right? And even if that's an ability for them to be able to get on a computer and get on Zoom, and what does that look like? And do I have a smartphone? And can I use that to connect? And so, yeah, I think with technology, right, I always say it's my love-hate because we certainly have some that are like, can't even get an email.
Exactly.
You know, I don't know how to send you a picture of what my arm currently looks like because I don't know how to do that. So I think it's one of those that, yes, can it provide the access? Yes, but does it always? Absolutely not. Yeah.
Right. Interesting. How are your students dealing with this? Do you feel like it has changed their perspective of medicine and the safety of medicine and going into it? Because I know there's been talk of people changing their career paths in the middle of because of what we're seeing.
Absolutely.
So I'm curious.
Yeah, no, I think that's a great question. And you know, as I like to tell students, I often feel like I'm reading between the lines, and some of those reading between the lines comes in the anxiety that I didn't necessarily expect for some of them. And I have given sort of them the permission to say, you need to have the permission to feel what you feel, because I think being allowed to feel your feelings is valid. So this is scary. And I see it in a lot more of the questions about when we go out on clinicals, how will we be protected? And questions around, you know, as a provider, how comfortable am I with thinking about being on the front lines, right? I think we talk about in our profession that, yeah, that's our call. But I think when you see it, and especially the media around that, I think as I've told them, remember, right, that's a slice, that's a view, that's not necessarily what is happening everywhere. And so I think it heightens the anxiety and the unknowns. And I think that's hard for students to wrestle with. And so whether or not it's actually something that they want to still do as a profession versus the emotional wrestling that's happening with safety and how does that look as a student and then as a provider, and not having a lot of control over that right now. There's still so many unknowns for them that I think it just heightens the anxiety, not even necessarily about the situation and how to protect themselves, but about everything in general of, will I be able to get a job to, is this the field that I actually want to be in?
Right. Very interesting. That brings up a good point. Where are you getting your information? Where is the reliable information for you, both as a provider and as an educator? Where are you going to?
Yeah, it's a really good question. I feel like Mesa County Public Health has done an incredible job of creating excellent access and really good resources that they sort of take anything they hear from the state, digest it down to, I feel like, for not only providers, but also for our community in digestible ways. So that is the first place that I'm sending students. And I actually said last week, I want that to be your resource, and I don't want you watching the news, and I don't want you watching, you know, the CNN and MSN coverage, because really I think a lot of what that's doing is it's just raising their anxiety. So go to the trusted source, hear what they're saying about what's happening in our community, and obviously if you have that same source, you can look into for friends, families at home, but don't spend too much time scrolling the internet looking for the stories that are sensationalized. And I think that is the hard piece for them, is just sort of trying to figure out what is sort of the truth in this, and how do I keep myself safe, and really what do the numbers look like here in Mesa County, and what are we doing when we're looking as a community at the epidemiology and the community health piece of truly flattening the curve. So I think helping them kind of wrap their head around all those different tenets of what we communicate is really important.
No, that's great. It is. They have to take control of when to turn things off.
Yes.
And that's hard because we're inundated with it. It's just constant. So, I mean, my 10-year-old's writing a journal about COVID. I mean, and he can spell coronavirus. And I'm like, that's kind of sad a little bit, but it is, you have to kind of learn how to turn that off. Well, that's good. We've been doing some series through CU Anschutz. They have an Echo series every Monday, Wednesday, and Friday that has some great information, and they do that from Colorado Health Department and their data. And so
I like that.
Been trying to get that out to some of the providers that, let's make sure, and we're looking at the right resources. Yes. That's so important.
Yeah, it's huge.
Well, good. Well, kind of more on a personal level, how are you feeling, or how are you coping with all of it?
That's a really good question. I like to tell people, I feel like it's the both and, right? Like I would say weary, but hopeful. You know, I think those are sort of the two places I sit most of the time. You know, I think the weary piece is like constant decision making amidst data that isn't always it's in motion, right? So everything, I feel like we're getting new information that's coming in all the time. We're trying to digest that and then make the best decisions possible. And a lot of that has to do with students, and when can we have students back in the classroom? When can we have students out on rotations? When can we have students? And I think the weariness comes from having to cancel big events. You know, they had their pinning ceremony coming up, and it breaks my heart that we're not going to be able to celebrate that huge milestone. And yes, we'll celebrate it at some point. But I think it's those pieces, right, of the birthdays and just the little things that you really look at and say, hey, those are meaningful. And I think that brings some of the weariness. I think the hope is also in looking at, man, this is a cool time that I've seen a lot of people come together in our community around a collaborative that shifted from individual, the lens just on me and my health, to, hey, how do we really make this better for our community, and how do we really ensure that we have the resources that our community needs and that our healthcare system needs in order to be able to serve those that may be affected by this. And so I think I get a little bit of hope around and see that also in student eyes when I say, hey, this is the next generation of those that are going to go out and care for folks, and they've had a very different emotional experience just during their education. It's going to change who they are as a provider. And so really trying to take some of that learning and really apply that to, now who can they be as providers? Which gives me a lot of hope for those that are going to be out and caring for me as I age and those in our community. So
exactly. Oh, that's great. That's a really good point. It will be very interesting to see how even just the dynamics of leadership and even compassion change as these current students go through this.
Yeah. So. And I think watching them wrestle with it and realize that these are hard things, and as we have said in our program, like, and we can do hard things, and we are crew, not passengers. This is not a passive education where we just get to fly. Like, we all need to jump on the ship, and I think they're seeing that play out in our community, and so it's a real tangible to the importance of interprofessional education and a greater understanding of the healthcare team as a whole. So I think it's, you know, I never would wish this on anyone to have to go through this. And as I say to students, like I didn't learn my education during a time when there was a pandemic, but there's some cool things that are going to come out for you if you stay in it.
Yes, yes. So, and you may or may not want to address this. I was just kind of curious. I know that Colorado Mesa had the student who passed away, was I think their youngest in the state at the time. How did the university respond, or as a community? I mean, Mesa's, it's still pretty big college, but it's still a community. So I was just curious how that was dealt with.
Yeah, it's a really good question. I think it's one of those pieces where, you know, all of us being off campus, it has felt so different because that community collaborative that I think we would feel daily on that very tangible basis is a little bit removed, but certainly feel, and the sentiment kind of around the CMU community was, yeah, let yourself mourn. And I think allowing students to also voice kind of the scariness around that, you know, I think it really brought to the surface like, oh, this is why we're not in class. And this wasn't just sort of this irrational decision of like, you know, we're shutting everything down. But I think the real tangible piece of like, yeah, that touches all of us. You know, we've had, you know, a few students that have been touched by this in a really meaningful way. And I think it's brought up really good conversations on how do we have these hard conversations around death and dying, and when it feels close and tangible, especially in someone that's young and healthy.
Exactly. Exactly. Very interesting.
Yeah.
Well, I really appreciate your time. Is there anything else that you feel like you'd like to add to this story?
No, I feel like these are great questions, and I'm so grateful that you guys are capturing this, because I think it will be interesting to watch what happens as we all kind of come out the other side of this and grow in who we are as people. And I think you hit a lot of the really good highlights of, you know, growing in empathy in how we think about access to care for so many of those folks that we care for.
Right. Well, excellent. Well, thank you so very much.
Yeah, you're welcome.
I'm going to go ahead and I'll stop the video now.